Hello, my name is Beth Payne. I'm a Master of Public Health student here at Eastern Washington University. And today we'll be talking about my applied practice experience, or APE, as I'll be calling it during this presentation. The agenda for today is we'll go through a little introduction about my APE, the major work products that I completed during my time in my APE, and the activities that were done, and the connections of those activities and those major work products to the competencies. We'll finish up with a conclusion and reflection. And then we'll take a quick look at the appendix, but not go through it in depth. All right, for the introduction. So the purpose of this presentation is for me to explain the work that was completed during the APE to meet the requirements of the MPH program. For my APE, I had the pleasure of working with One Community Health, which is a primary care entity that is local to me in Hood River, Oregon. And they are Community and Migrant Health Center. My site supervisor was Michelle Guerrero, who is the marketing communications manager. My role was to provide my site with a useful communications product that supported their diabetes patient population. I had the pleasure of learning from staff there at One Community Health and at the Department of Health in order to learn more about ways that we can fill care gaps for the diabetic patient population. And the request that my site had was to utilize their email platform more. It was a space that they weren't using very much and didn't have very much expertise in, and they're having a hard time getting it off the ground. So my role was to learn about the disease state, learn about the patient population, and ultimately provide them a product that they could use with their email CRM after my APE was complete. So it's a good segue into the major work products. So the two main work products were an email CRM. CRM is customer relationship management. It's usually referring to a software or a system where companies and organizations can have their customers in one place and be able to interact with them in certain ways. And some of them have automated features, and that was kind of what we were discussing for this one. So how can we use the email that was in their CRM to set up automated educational messages for their diabetic population? So the other piece of it was a messaging guide. The messaging guide supports the emails that are in the CRM, and it also can be used to support other outreach efforts based on all this research that I conducted in order to understand people with diabetes and especially those in the diabetic program at the clinic. So we used the EHR data from the clinic itself and did a landscape review of other materials in the diabetic disease sector. So some of the activities for the email CRM workflow. So I spent about 40% of my time working on this work product. The inputs that were used were mostly when I was able to work on site or at my home office. Supervision was pretty minimal for both of the projects. However, many experts, including my site supervisor, who is a dietitian, were consulted and collaborated with. Again, I worked with One Community Health and folks in the diabetes and cardiovascular health sectors within the Department of Health in Washington State to learn a little bit more. So the resources that were included for this activity were Constant Contact, which is a CRM platform that One Community Health uses, Canva, which this presentation is on, Outlook, email, Microsoft Teams, a lot of online research, and again, the EHR data or electronic health records data. All right, for the activities. So lots of them were just many meetings with many people. So meeting with my supervisor and marketing staff to make sure that the product was meeting their needs, and I was understanding how they had interacted with the patient population in the past. again, data reviews of the AHR diabetes patient data. So we pulled multiple sets of data, trying to really understand their demographic and their needs and where the gaps were between folks that were using their more in-depth program and folks who weren't, and how we could reach them if they weren't using the in-depth program. And also, like I mentioned, a review of online diabetes-related sources from resources from quality sources such as the American Diabetes Association and the CDC. The outputs for this was the main activity, the main work product of the CRM workflow. So the other outputs included meeting agendas and notes, and all of this is included in the appendix, which I mentioned that we would touch on but not go in depth. And the workflow is just a systematic view of how patients would receive emails, in which order they would receive them based off of topic, and some information about themselves, such as when they were diagnosed and what their A1C levels are. So for the anticipated outcomes of these activities, that would be this tool. So the CRM workflow is a tool for staff to create this email CRM with over a year's worth of emails for multiple patient audience segments. So we do talk about the segments within the CRM workflow, as well as the messaging guide, which we will talk about next. So we'll move on to this other activities for the work product of the messaging guide. So I spent about 60% of my time on this. This was a much bigger lift because it took a lot more research and actual writing of content. So the inputs were, again, lots of meetings. Learning about the patient population and the disease state went directly into the content that was created for the emails, or messaging guide, if you will, in this case. And we used the same type of resources to be able to gather information. Okay, for the activities, similar to meeting with folks, lots of experts. The review of online diabetes-related resources, this one played a big part in creating the messaging guide to see what other quality sources were trying to bring to patients, what were the most important, or the gaps that they were trying to fill in their communications, and how we could leverage these resources to build patient trust and have good resources for them to access outside of these emails. And then I also created a presentation and a training of the work products to the marketing staff and the chief innovation officer. So I was able to hand off the products to them with a collaborative training and presentation on what I had completed. And we went through some examples of the content in the messaging guide so they could understand it best. That seemed to go really well, and I haven't gotten any follow-up questions from them, so I will take that as a win. So the outputs, of course, the messaging guide. And in the messaging guide is kind of a piece of this email outreach manual. The manual is very robust. It provides information about how to use these two work products, best practices for email outreach and CRM management, a landscape review of materials, and other tips and tricks for how to best communicate to the audience through email. And of course, the presentation that set the stage for training staff on how to use the work products. The anticipated outcome is that staff will have this tool to really lean in and be able to create over a year's worth of emails, and not just how to set it up in the CRM, but actually what to write about, what the primary messages are, the secondary, and many, many resources that they can either pull from or link to for patients to be able to learn more. The whole hope of this is that patients will have a trusted source, so their care provider network, One Community Health, reach out to them, push information to them, if you will, so that they can get information to self-manage their diabetes without having to go into the world and seek it out. I learned from my research that when patients may Google it, if you will, there are so many resources out there, and it's really overwhelming. So hoping that, again, this trusted source of their primary care, being able to give them curated information, can help them find the information useful and apply it to their lives for the self-management of the disease. Okay, moving on to the competencies. So you can see that there are 5 here. We'll go into the details, so I won't read them now. All right, so these first two, so there's select community strategies for different audience and sectors. This one was a lot of what I was doing with the segmentation. So there are different audiences that are getting different emails based off of information, which I'll read now. So there's the A1C level, which is your blood glucose level over the last 3 months that diabetic patients get checked at least twice a year, if not more, ideally. It's also segmented by their preferred languages that's indicated in the EHR and whether they or not they have a new diabetic diagnosis or not. And that piece is important because we don't want patients who have had diabetes for a long time enter the email system with really 101 type information that might be insulting to them as if they don't know these things. But if someone gets a new diabetic diagnosis from their doctor, we don't want to skip ahead and give them in-depth information when they might just need some basics of what's changing in their lives. So all of those nuances are really important, and they do change how we communicate and what we communicate to different audiences. Okay, the next one, C21. So it's integrate perspectives from other sectors and or professions to promote and advance population health. Oh my goodness, this is so much of what I did in those activities and working with so many different people. I have a big long list of folks that I worked with, from marketing staff, chief innovation officer, diabetes and cardiovascular health program at the State Department of Health, diabetes program staff at my site clinic, who they're the ones that are working hands-on with patients, and those are community health workers, dietitians, and nurses. Then also worked with the communications and population health teams at my site. So many perspectives were brought in from both public health and clinical health, and that really gave a well-rounded approach to this information that we could meet the patients with public health messaging, as well as some clinical information that had some call to actions that were really helpful for them. All right, moving on to the next ones. So C8, so apply awareness of cultural values and practices to the design or implementation of a public health policy or program. So for this program, when I was meeting with all of these folks, I wanted to learn about their patients' values and cultures and the way that the clinic itself incorporates these into their work. One community health, as I mentioned before, is a migrant and migrant farm worker and community health center. And that's where they started. That's their roots. And understanding the cultural values of their patients is really important to the work that they do. And it's not just translating information, which they do. Everything is at least in English and Spanish. It's about really understanding the cultures. They don't necessarily host a Halloween celebration, but they do a one for Dia de Muertos. And it's really important that they make sure that their patients feel seen and that they're a part of a community. And then I pulled that into the CRM. So it's been a really important piece of it. And within the messaging guide, there's a lot of considerations. There's one section of that for every single email. And in those considerations are a lot of cultural values. Okay, C19. So communicate audience appropriate public health content, both in writing and through oral presentation. Right. So in the meetings and research, I wanted to make sure that the content was created for my work products that was relevant and appropriate to these audiences. In that I created these materials. So it was in writing, in the messaging guide, and in the workflow, and through oral presentation. And not just this oral presentation, but the training that I gave to the staff. So I made sure that the training, I created a presentation that was specifically for them, and I spoke to them as marketers as they are, and not in the way that I would speak to patients. And I made that clear that the materials I was handing to them were for patients, were for them to interpret the way they should speak to the patients. But the oral presentation I gave used jargon that they were familiar with, and we all understood the differences between that. So it was audience appropriate, the content I created in writing, and the oral presentation that was given. And finally, apply system thinking tools to a public health issue. So I performed a strategic mapping of the email tracks. So the email tracks are the flow, if you will, of how a patient would move through a system. They get one email and they move on to the next. And that was actually mapped out per content type. by audience segmentation that I had mentioned earlier. So that strategic mapping was to determine the most optimal order and topics per audience segment for each track. So the systems map, which is the email CRM workflow, is a high level view of the email flow that does inform the messaging guide. The order in which the audience receives their emails will impact their experience and educational journey. So it's very intentional. All right. Here we are at the conclusion and reflection. So, key takeaways from me and my site. The first one is that I learned so much about a chronic disease that I was unfamiliar with, and that's really important to me in my learning and growth in this field. Not only to learn something new, but to know that I can, and that it's important to see the world and see patient populations for everything that they are. And next is that I had a better understanding of FQHC and how they operate and what data they can use to best reach their patients and how it differs from public health. So I work in public health space now, and we don't have that individual patient data like this primary care setting did. And it was interesting to see how they were able to connect to their patients in different ways. And that made a big impact on me, which we'll talk about in the reflection here in a minute. And one thing that my site learned through the pulling of the data from the EHR was that we understood our diabetes patient population a little bit better. So, as I had mentioned, there's a diabetic program, and they work really closely with patients who are most at risk, if you will, and they tend to be a specific demographic and have a specific preferred language. So the program came to us and they're like, oh, our diabetes patients don't have email, so this program won't work. And when we dug into the data, we found out that that wasn't necessarily the case, that there were over 50% of patients did have emails, and that they weren't all enrolled in the program. And the goal isn't trying to get folks enrolled in the program because they don't have the capacity for that. And some people are able to self-manage. So it's really just trying to make sure that the people who aren't in the program, who do have other ways of being reached that can self-manage a little bit more and just need a little extra help, were reached. And that wasn't super clear if it made sense or not to do this program because they didn't fully understand their diabetes population. I think everybody was a little surprised about the demographics, the preferred language, the race and ethnicity of the folks that have diabetes in the community. And I think it kind of just was a wake-up call of, okay, you know, we had an idea and we didn't have evidence inform the way that we were approaching this population, and now we can do that because we understand it a little bit better, and it validated this program, or excuse me, these work products, if you will. All right, so conclusion and reflection. I'm not going to go through all of these, but I learned a lot. I learned a lot about how I can apply these skills. Again, knowing that I can learn new things and I can work in different settings and apply the skills that I've got from not just this APE, but from this MPH program, can apply them in different settings. So public health or primary care. Professional knowledge and skills and abilities. I just learned that I can apply them to different organizations and just provide drug patient care. And I guess by drug patient care, I mean working at a system where I know the patients a little bit better because of the data as opposed to a population health. One other thing that was interesting for me was learning about where public health shows up in workplaces. It, I think, in one of the lectures, they mentioned, any company, you can do your APE anywhere because it does show up everywhere, public health. And I had a hard time with that, just really understanding, and this really helped me realize where it is and gave me different perspectives of public health, and it validates that my skills are applicable to a variety of places. So I've also expanded my resume to include professional networks that are not governmental which is where I work now, that I can work locally in my tiny town, and I can work in different settings, like I had mentioned. So I did learn of some weaknesses as well, and I think is that I just need to spend more time with the population that I'm focused on in my work, and this is directly applying to my work that I have now. I serve a community that is unfamiliar to me, and I haven't spent much time with them, and it's a disservice to those people. And this has made me realize that there are changes that I can make in my professional work to better my work and myself. All right, and preparing for employment. As I mentioned, I'm already employed in public health, but my APE did prepare me for other types of employment in different settings, and that has expanded like how I look at public health as I grow my career. And that was kind of one of my big goals of doing this MPH program. So I'm glad to conclude my time here at Eastern Washington on that note. So I want to thank you for your time. And we just take a quick look at the appendix just for good measure. So the first appendix has a CRM workflow, the messaging guide, and the email outreach manuals, which are all tied to the main work products. And then there's supporting materials, which are the meeting agenda and notes. And then the slide from what I was calling the mini presentation and training that I provided to my site as I handed off my work products. All right, that concludes my presentation. Again, thank you for your time, and I thank Eastern Washington University for giving me this opportunity, and of course, One Community Health for allowing me to spend time with them and hopefully support their work moving forward.